Let's discuss the relationship between shoulder pain and the size of your scoliosis. One of the most identifying things with scoliosis patients is unlevel shoulders and shoulder tilt. So one of the most obvious things is that, well, if its shoulders are being so tilted, can it cause shoulder pain? Can it affect the way my shoulder functions? Can it lead to discomfort in the shoulder area, arm, upper back? And so the first thing you have to understand is that scoliosis affects everybody very differently. And some people have a lot of symptoms when it comes to their scoliosis, and some people lack them. And there are very clear categories on why some patients experience symptoms and pain and why some other patients don't. So one of the most common pains associated with scoliosis is going to be, of course, back pain, it's going to be headaches, and it's also, in fact, shoulder pain. Shoulder pain is one of the most common symptoms associated with scoliosis and tends to affect as cases get more severe, meaning if you have a mild case of scoliosis, meaning the Cobb angle is between 10 to 25 degrees, the likelihood of it causing pain is much less than when you're dealing with something that's more severe. A moderate scoliosis is between 25 and 40 degrees, and then a severe scoliosis is greater than 40 degrees plus. I also have this fifth category that I call very severe scoliosis, which is like 80 plus degrees. So mostly when you're dealing with adolescents, meaning adolescent idiopathic scoliosis, pain is very rare. You very, very rarely feel any kind of pain. If they do, it's dull ache wherever the curve is experiencing. Now, interesting, if they have a high curve, a high thoracic curve, they may feel pain in the shoulder area, meaning because that's where the curve is. However, adults tend to experience more pain as a result of scoliosis, and the reason why is because what's causing their progression over their life is gravity over time, which tends to be more pain associated with it. So how can scoliosis affect the shoulder? Well, first and foremost, we know it affects the way the shoulder girdle sits. It causes a tilt in that area. So when you tilt that area, affecting with one shoulder higher than the other, you're affecting the head being off to one side. This unnatural or unsquare position can affect the biomechanics of the shoulder, and that biomechanical error or unalignment can lead to shoulder pain and discomfort. Second way is when the spine's out of alignment, it also affects the nerves in the neck. And when you affect the nerves in the neck, you're affecting whatever those nerves are going to, which is going to be your shoulder, upper arm, and hands. So scoliosis can affect it that way as well. Last thing is as scoliosis develops, it causes something called rotation. And as the spine rotates, the ribs rotate with them, which can cause the scapulas to sit in different positions. This asymmetrical scapular position can cause an effect to the shoulder alignment. So those main areas are what can cause shoulder pain in a scoliosis patient. The more asymmetrical the spine is, it causes these muscles to work harder, and as these muscles work harder, they're working harder to support the spine. So what can this pain feel like? Well, first of all, we know it can create tightness and soreness. Knots in the area are very common, and what patients tend to do is they tend to go seek out something like massage or some kind of soft tissue therapy to try to help the area, but they find their improvement to be very limited because those things are not correcting the structure. When it starts getting more severe, it can cause radiating pain down into the arm, into the shoulder, create a burning sensation, can even lead to some numbness in that area, because when you're affecting the nerves, it can affect those areas as well in that way. So how do we treat scoliosis pain? Most importantly, how do we treat the shoulder pain as a result of the scoliosis? Well, just addressing the pain, like I mentioned earlier, or just dealing with the symptoms. So if you're just rubbing out the knots, rubbing out the tissues, using massage or some kind of percussion instrument, sure, that helps, but it doesn't really reduce the cause. Even if you're doing medications or injections, the same thing. They're more like dealing with the symptoms. Ultimately, you want to get to what's causing the shoulder problem to begin with, and that's normally the asymmetry associated with the spine and the asymmetry associated with scoliosis. So the way you change that, when you change what's causing it, is when you make the pain get better and you make it stay better because the body's now in a more naturally aligned. So our approach in terms of dealing with this is dealing, number one, with chiropractic care, getting some adjustments done to the spine to help remove pressure. It's specific scoliosis therapy that's done to help reduce the curve using passive therapy and active therapy. It's home prescribed exercises that that are done in a very specific way to help reduce and stabilize the scoliosis. And of course, if needed, we use scoliosis bracing, but we use only corrective bracing that's going to be pushing the spine into a correct position. The combination of those treatments will be done very specifically based upon your scoliosis presentation. And most importantly, if you have a thoracic or upper spine scoliosis, like in your neck or in your upper back, those tend to affect the shoulder more often than like a lumbar scoliosis. So if you're experiencing shoulder pain and you do have a scoliosis, your first thing is to look for somebody who specializes in scoliosis treatment to see if we reduce that curve, is that's what's causing the problem. Unfortunately, some patients can go through unnecessary treatments, like even shoulder surgery, and they actually have ligaments tightened, and they find that it's not really resolving the issue because the result is, or the problem is coming from their scoliosis itself. If you have scoliosis currently, and then you know it's an upper spine scoliosis, meaning upper back in your thoracic spine or in your neck, I would recommend being proactive, meaning reducing the curve and managing the curve before it progresses to where it becomes more severe and more likely to cause shoulder pain and discomfort. So this is what I really recommend, and you can go and find our results and see the kind of results that we can get in reducing scoliosis patients, even in adult patients. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.